Hi everyone, very good afternoon and welcome to this YouTube session. And in fact, this is going to be a series that we are currently conducting starting from 21st, that is today, moving up till 27th. So this is going to go on for this entire week, all 7 days. And this entire series that I'm talking about will be split up into two parts. So for those who are joining in now and who are not aware of it, this series will be a series which will start at 2:30. So 2:30 to 3 p.m. we are going to meet on the YouTube channel, and in this we'll discuss some very preliminary basic kind of questions that are important for the exams. So we'll have like approximately 5 to 7 questions that we'll discuss. Shortly after, within 5 minutes, that is from 3:05 p.m. to 3:35, there's going to be a half an hour class that we will, not a class per se because it's not going to be academic, but there's going to be a class that we will conduct on the Unacademy app, and that is going to be an open house session. And for those who wish to know what is an open house is more of a talking session where we mutually discuss what are the problems and obstacles or roadblocks that you all are facing in your preparation. It's also a two-way thing, which means that not only I get to talk, but also especially the iconic subscribers can join in over an audio call and also put up their concerns that they have. But just in case you want to join in, all the students who have not even subscribed, it's free for everyone, and we'll keep it very short. But all these days I'll pick up one pertinent topic. Like today I'm planning to discuss with you something to do with the revision strategy. So yes, every day we'll pick up one pertinent obstacle that you face in your preparation and we'll try and solve that out. Right now the open house is not available, Dr. Nirupam. It will start at 3:05 p.m. So that is when I will start it from my end, is when you all will be able to join it as well. Abhi ke liye, let us go in for the session which we have. We have to discuss a very quick 5 to 7 questions that we have. So let's begin right away. And here you go with question number 1. So 5 questions minimum. Question 1 is in front of you. Cytogenetic studies of a 40-year-old woman with follicular lymphoma demonstrates 14-18 chromosomal translocation involving the BCL2 gene. Constitutive expression of the protein encoded by the BCL2 gene inhibits which of the following processes in this patient's lymphocytes? So I have started getting a few answers out here, I suppose. One answer is definitely on track. Yes, so started getting more, and all of you are on track. So the easiest one we began with, and everyone knows the answers, and that is going to be apoptosis. So the point over here was, it started off as a hematology question, which was follicular lymphoma. I totally agree, follicular lymphoma tends to show us translocation 14 and 18. And in terms of prognosis, how is follicular lymphoma for the patient prognostically? It's always said to have the good prognosis. Basically, in terms of the non-Hodgkin lymphomas, it's the best prognosis non-Hodgkin's lymphoma that we can have in a patient. And this happens because of translocation 14 and 18. Whenever there is 14 and 18 translocation, there's an increase in the BCL2 that we see. And I hope all of you remember, BCL2 gene or BCL2 protein is basically anti-apoptotic. In fact, we have one very famous general pathology question also. Today I've tried to bring in things only from general path because it's the first day. So we have BCL2. In fact, if you remember this list that we study in chapter 1. In chapter 1, we study a list of which are the pro-apoptotic factors and which are the anti-apoptotic factors. Okay, I think someone has mentioned that there's a problem with the screen. So anyone else facing that issue, I think we can try and sort it out. Let me know if everything is okay now and is visible. Yes, I hope now everything is sorted in the screen, correct? So this is what I had written earlier, and I think okay, it's better now, I suppose. Fine, I'll restrain from writing on the extreme sides of the screen that we have, and I hope we are able to visualize things better now. Okay, so yes, BCL2 anti-apoptotic, which brings us to the next thing, that which are the pro and which are the anti-apoptotic factors that we need to consider. So wherever I had given you a mnemonic for that, P53 backs BCL excess apoptotic, BCL2 MCL1, and BCL of which type? There's a BCL XS here and there's a BCL XL here. So all those L related things, all the things related to L, they are the ones which are going to lower apoptosis. They are the ones which are going to lower apoptosis, or basically you are going to remember they are going to be anti-apoptotic. Here in the question you had BCL2. So when I say BCL2, definitely it's going to function where? Where is it going to actually be a problem? It's going to be a problem in the anti-apoptotic pathway. So I hope that part of it is clear to everyone. Yes, okay. So having said this, this was an easy question, but when we've discussed this question, we can always devise a few translocations also, which will help me in pathology a lot. So let's start with that. I'll start with the chromosomes numbers. I'll write the numbers and you can help me with the combinations that are different chromosomal translocations that we have. So firstly, when we are talking about 14 and 18, when we are talking about translocation 14 and 18, what is the chromosome or what is the lymphoma that we studied right now? We studied the follicular lymphoma. Follicular lymphoma. Because 14 and 18, both of them are teen, right? So 14 and 18, friends. Teenagers are always friends. And follicular lymphoma is my friendly lymphoma. Friendly lymphoma means it's a good lymphoma. It has a good prognosis. So 14 and 18, friends, good prognosis, follicular lymphoma. Whenever I have 8 chromosome involvement, now that 8 chromosome involvement could be 8 and any kind of an even number, all of you know. It could be 822. It could be translocation 814. Again, even number should be there. It could be translocation 2 and 8. Again, even number should be there. So whenever I'm dealing with 8 and an even number, yes, we are dealing with a case of perfect. We're dealing with a case of Burkitt's lymphoma. So the Burkitt's, as all of you know, Burkitt's looks like a B. B basically refers to 8. So 8 is how this is going to come up. Okay. Yes, 821, I'll come to that in a while. First, let's finish off this one. So now what am I left with? Let's look at this end. 11, 14 and 18 may say, if I take up the two marginal things, if I take up translocation 11 and 18, you're saying, ma'am, you've taken up the numbers at the margin. So you're dealing with a case of marginal zone lymphoma. No, not mantle. Margins wala number hai, so we'll talk about marginal zone lymphomas. Whereas when I talk about 11 and 14, that is what all of you are telling me. When I'm talking about 11 and 14, that is when I'm talking about mantle cell lymphoma. So there should not be any confusion, I hope now. Very clear, very categorical that we have over here. Let's revise once again. When I'm talking about the 8 related things, I'm going to have Burkitt's lymphoma. And 8 has to be with an even number. That's the rule. When I'm talking about teenage, the two teens, that's going to be friendly follicular lymphoma. When I'm talking about the two marginal numbers, I'm talking about marginal zone lymphoma. And when I'm talking about the remaining 11, 14, I'm talking about mantle cell lymphoma. I hope that's okay with everyone. But someone had put up a query in between which was very valid. What if I write translocation 821? So you know, when we look at 8, you suddenly feel that this is Burkitt's, but 8 has to be with an even number. This is 21. So 822 would have been Burkitt's. 821 is not Burkitt's. I hope you all remember from hematology. 821 is something that we see in AML M2, acute myeloid leukemia M2 type. That shows me this translocation. So I think the first question was an easy one from general path, but it helped us in analyzing a lot of translocations which are important for the exam. Let's move forward and let's look at question number 2, which comes up as a question of obviously general path, but I hope all of you will be able to answer it. So I've tried to show you a GIF out here, and please visualize it and answer accordingly. Which of the following methods aids in the cellular event that has been shown below? There is a cellular event which all of you can see below. And okay, so the event that is mentioned very clearly, as I see, This is a blood vessel. Why do I call it a blood vessel? Because I can see all the red color blood inside it, and I can see one cell which is rolling. Basically, the step that has been mentioned over here is rolling, and all that this was, it usually used to come as a one liner, but now because we've got more questions coming to you as images and GIFs, so this could be a variation in the question. So when I talk about rolling, obviously rolling is caused by molecules called selectins. So my first question to you is, rolling is happening between which molecules? You can definitely see a white blood cell over here. This aspect is showing me a white blood cell. What is it rolling over? It is rolling over these endothelial cells. It is rolling over the endothelial cells. So let us draw this diagram once again so that I can mark the selectins and you can mark it for me. So for example, if this is the WBC that I'm talking about, probably the neutrophil, and for example, if this is the endothelial cell that we had, so the rolling is happening between these two cells. How many types of selectins do we have? When I talk about selectins, I hope everyone remembers, we have three types of selectins called P, E and L. P, E and L are the selectins that we all know of, and first let's label it. L-selectin. Where will L-selectin be present? You'll say, ma'am, L-selectin will be present over here because L means leukocyte. L-selectin will be present on the leukocyte. Next, if you ask me where is the E-selectin present, I'll say E for E. E-selectin is present on the E, that is endothelial cell. L-selectin, L for L, E-selectin, E for E, and lastly, where is P-selectin present? The way you pronounce P, there's a sound like this that comes. When we say P, it sounds like P and E, right? So number one, it is going to be present in P for platelets. It's present on the platelets. Here I've not drawn the diagram of a platelet. And number two, it is again present on an endothelial cell. So P-selectin also I will be making over here on the endothelial cell. So the location we have revised. Which selectin is present on which cell and how does it bind? What molecule does it bind to? So please remember, P and E are on the endothelial cell. Which molecule will they bind to on the leukocyte? They bind to sialyl Lewis X. They bind to sialyl Lewis X. L-selectin is present over here and it binds to something known as glycam or madcam. It binds to something known as glycam or madcam. These are the two things that can be put up to you, glycam or madcam. So I think this is too much of detail that we've done. Our question was a very simple one in which they tried to ask me that this process that has been shown is known as rolling, and rolling happens to be because of selectins. What about the others? Can you also label what does integrin do? If you can quickly revise for me. Integrin helps in the final sticking, that is the final adhesion. That is what integrin helps in. Next, if I ask you what is PCAM1, what is PCAM1 also known as? There's a CD marker that I associate with PCAM1. PCAM1 also known as CD31 is going to help in diapedesis. It helps in diapedesis. And finally, opsonins, for obvious reasons, will help in opsonization. So there's no difference in that. So this was an easy question. Again, done. If you want, we can move on to the next one. Yes. And this is the next question that I want all of you to attempt. So look at the method of culture plating that is being depicted over here and let me know. Method of culture plating being depicted over here. Look at the entire GIF. Okay, so most of you have given me a final answer, and that final answer is the way it's happening, as if someone is, making a streak or a drawing out here. Yes, so this happens to be a streak culture. This is a technique known as streak culture. So there's a nichrome loop. Let's analyze this. First, we heat a nichrome loop. We heat a nichrome loop because that is our way of sterilizing the loop, because we might be reusing it. So first we heat it, we dip it in whatever sample, maybe you have a urine sample, maybe you have a sputum sample, whatever patient sample you've got, you first dip it in that, and thereafter on your culture plate you are going to streak it in this manner. Then when you have another sample, you'll heat it again, then you'll take the sample, then you'll streak it. Then third patient, heat it again, that is how it goes. So you're basically streaking, and that is why this was a clear-cut technique that is known as the streak culture. So most of your culture plates you must have seen like that only. But what are other two? There's something known as a lawn culture or a stab culture. Let's finish those off also. So for example, I'll draw and I'll tell you when would you analyze a lawn culture. So for example, if this is your culture plate, if this is our culture plate and you say that, ma'am, I have my patient has urinary tract infection and I have received a urine sample in my lab. My patient wants to know what is the organism that has caused that urinary tract infection. So what can we do? The urine sample, obviously not the entire of it, some amount of it can be spread out on this entire culture plate like a lawn, like a carpet, like you spread out a carpet. So over here you are not creating any streak like that. No, the sample is not being streaked onto the culture plate. The sample is entirely, this urine sample, it is being spread out on the culture plate like a lawn. So if you're spreading it out like a lawn or like a carpet, then obviously you are going to call it a lawn culture, or you're going to call it the carpet culture also. That is a common thing. Lawn and pore plate are not the same, because in pore plate we have further amount of dilutions that we create. So lawn and pore plate do not stand for the same thing. Pore plate can be done on multiple ones with multiple dilutions that we can create. There was one more that I had in my previous one, that was stab culture. Anywhere that you guys have heard of a stab culture, because this is a very famous technique that we do? Any famous place where you've heard of something called gelatin stab? Anyone who can recall for which bacteria do we study gelatin stab? Gelatin stab, very much, very good. We study it a lot for Bacillus anthracis. Amazing, yes. Because you must have heard this technique or this word, that Bacillus anthracis on a gelatin stab gives an inverted fir tree appearance. I think that is something we all know. Inverted fir tree appearance on a gelatin stab. So karenge kya? We are going to, as the word says, what is your culture medium containing? Always the culture medium, if I call it blood agar, it contains blood. If I say it is going to be egg yolk agar, means it contains egg yolk. When I'm saying there is a gelatin stab, I want to tell you that this particular test tube is full of gelatin. This particular test tube is going to be full of gelatin out here. So what am I doing? Now you say that, ma'am, my patient sample is ready. Are you going to use this same kind of a nichrome loop and are you going to make the gelatin stab? No, we try to use a plain wire. We try to use a plain wire because just like what is the action that we always have for stabbing whenever they show in movies or in any place? They always, it's a single one time action, right? Stabbing means just one in and then out. That is how stabbing works, right? So we are going to take this wire which doesn't have any loop in front of it, a plain wire. I'm going to dip it in my patient's sample, whatever sample is it, and this wire one time in and out. That's it. Just like a stab, once you stab the gelatin and the wire is out. Then you see what is happening. So then in case of Bacillus anthracis, the kind of growth that you get always looks like this. It will look like an ulta inverted kind of a fir tree appearance. Inverted fir tree growth or inverted fir tree appearance is what you notice in a case of Bacillus anthracis. So yes, Bacillus anthracis we've discussed a couple of times, but I hope everyone's understood what a stab technique is. In stab, it's just a one-time sample inoculation that you do. In lawn, you have spread out the sample like a carpet or a lawn, and in a streak culture, just like in your the way word tells you, you are going to streak it in this manner. That's why you're calling it a streak culture. I hope this question is also okay with all the options. Everyone's comfortable with it, because then we can move on to the next question, which is an easy one. Yes. So I think there's a little problem in the, in the question being visible or not. So let me know if all of you are able to visualize it. So there is Jack, who has been diagnosed with a mitochondrial disease. Sally, on the other hand, does not have any known condition. So Jack has been identified with a mitochondrial disease. Sally, on the other hand, does not have any known clinical condition. What are the chances of the child born to Jack and Sally having the disease? So again, a common answer which I've received from everyone, that is the first one. Okay, that is 0%. So I think this was a classical case of a mitochondrial inheritance, because they mentioned now the father has a mitochondrial disease, the mother, they have said, seems to be normal as of now. So I know for a fact that when I'm dealing with mitochondrial DNA or I'm dealing with any mitochondrial disease, I have one rule which I have to follow everywhere. And that rule says that mother can give the disease to all her children. The mother will give the disease to all her children, but the father will not give the disease to any child, because father does not give the mitochondrial DNA to any child. So over here, father had the mitochondrial disease. Father will not give the disease to any child, so 0% of the children would be affected. On the other hand, if I would convert it, if I would have said that Sally has the mitochondrial disease, mother has it, and Jack is normal, then what would your answer have been? Probably something which is not there in the options. If mother would have had, then 100% of the children born, all the children born to this couple, would have had the same disorder. But over here, if father has a mitochondrial disease, then none of the children are going to get it. On the same lines, why don't we follow, or why don't we solve one pedigree analysis also? So identify the inheritance chart that has been shown in the picture below. I hope it's again visible to everyone. That's the most important. Tiny technical issue that we are facing today, but I guess we'll manage. Identify the inheritance shown in the pedigree chart below. So please analyze what is happening over here and then let me know. Again, good enough. So that was a theoretical way of giving you the question. Here I want you to analyze the pedigree chart. Here I can see this is the female who has the disease. Male is normal. Male is looking normal. Now when they gave birth to 1, 2, 3, they gave birth to 3 children. From the mother, the disease has gone to all the 3 children. So somewhere my rule is being completed. That is, there is a mother to all kind of a phenomena that is happening over here. Now, when this girl became a mother, she has also given the disease to all her children. So, mother to all has again happened. However, when this boy became a father, when the father further gave birth to children, there was not a single child who had the disease. So, somewhere again, I have proved that father is not giving the disease to any child. And that is again a similar inheritance that I have for mitochondrial inheritance. Now, I want to ask you something on the a little higher edge. Can there be a possibility that when this mother gave the disease further, can there be a possibility that one of the children showed it and one of them did not? Is there a rare possibility where mother does not gives the disease to all 3, but one of them suddenly does not show that problem? Is there a possibility? Yes, I want all of you to know a term which is referred to as heteroplasmy. This will help you in your MCQ, especially in the NEET PG exam. When we are talking about heteroplasmy, first I draw a cell. For example, if this is a cell, and I always say that in a cell, the blue colored one is always the nucleus. So we always have 2 types of DNAs. All of us, every cell. This is the usual DNA that we have. This is the DNA that we have in our nucleus, which we've got from both parents, from mother also and from father also. However, other than that, we've also got a mitochondrial DNA. And mitochondrial DNA, I know, comes only from the mother, right? Now let's talk about a person whose mother had a problem in the mitochondrial DNA. So I'm making a red color for the problematic DNA. This person has received this much of problematic mitochondrial DNA. But at the same time, he or she, whatever this gender is, also has a certain amount of normal mitochondrial DNA. So I'm drawing the normal mitochondrial DNA more in quantity. So can I say this person has two types of mitochondrial DNA? A normal mitochondrial DNA is also present and a mutant mitochondrial DNA is also present. There are two types of mitochondrial DNAs that we have. As a result of which, can I say hetero? Hetero means different. Two types of DNAs are present. Agreed. Now I have to see the quantity of which is more. If the quantity of normal mitochondrial DNA is more, he might not end up showing the manifestations, the clinical signs and symptoms. If the quantity of the mutant mitochondrial DNA is more, then he will definitely show me the signs and symptoms. So there is a possibility that mother gave the mitochondrial DNA to the child, but the child ends up showing more of normal mitochondrial DNA than the problematic mitochondrial DNA, and then suddenly that child does not show you signs and symptoms. So there is a variation possible, and that variation goes by the name of heteroplasmy. So how would the question come on this? They would simply ask you that heteroplasmy is a condition which is going to be a variation in what? Autosomal disorders, X-linked disorders, or mitochondrial disorders. So I think now everyone will be able to answer that this is a variation that we see related to mitochondrial disorders. Yes, I guess with that we can wrap up this very quick session, and we can now move on to a short 5-minute break. So I've kept these sessions as extremely rapid ones because I understand that that is our agenda, to give you that midday boost. That is the only plan for this week. But yes, we'll be meeting in 5 minutes again on the Unacademy app. And this time it's going to be an open house session. So I think all of you can pick up the link which is already available on Telegram, join in, and at 3 o'clock, if you have any queries, you can raise your hand, talk to me, ask me. But if not, then today the plan that I want to discuss with you is how to make an effective revision strategy. So that is what I would want to talk. But yes, first priority would be, if you wish to ask me something, then obviously we'll discuss that on priority basis. So well, thank you guys for joining in. We'll be having such very short 4-5 question type of MCQ sessions every day this week. This is only to make sure that the post lunch sleepiness or the slumber that all of us go into, that is broken, and somewhere it gives us a midday boost to study further. So I hope you guys find it beneficial. So thank you for joining in, and see you very shortly. 3-5 exactly in 5 minutes we'll meet on the app, and we'll have another short 25-30 minute session where we'll discuss some practical aspects of our preparation. Thank you.